In order to answer a question about euthanasia well, you need to be familiar with the legislation in the UK and have a good number of points on the in favour of and against side of the discussion. So firstly, let's just describe or define what euthanasia is. Euthanasia is defined as the ending of someone's life, usually who is in a significant amount of pain from a particular disease or is having their quality of life significantly inhibited by some certain disease. So there are two types of euthanasia. The first type is active euthanasia, where a healthcare professional or a doctor administers an overdose of a particular medication. Quite often these are muscle relaxants, and that will actively end the patient's life. Then there is passive euthanasia, where a type of treatment that is keeping the patient alive is deliberately withdrawn, and that ends the patient's life. The other type of euthanasia is involuntary euthanasia, which is done without the patient's consent. Alongside this, we need to be aware of the term assisted suicide. So that is slightly different to euthanasia in that it is where a patient is helped to have their own cause of death. So the patient themselves will be the initiator of the action that causes them to end their own life. And then there's assisted dying, which is usually referring to patients who are terminally ill and helping them to end their own life. So in UK law, the action of euthanasia and assisted suicide are both illegal and can receive a sentence of up to 14 years. However, despite the UK legislation on euthanasia, there have been some circumstances where NHS services have withdrawn life continuing treatment and had it seen as a continuation of good palliative care. Euthanasia policy in other countries can be slightly different. So for example, it's legal in the Netherlands, Colombia, Luxembourg, Belgium, Canada, Spain, some states in the United States. So the arguments in favour of euthanasia are firstly to mention patient autonomy. So if patients decide that they are suffering so much from their disease that they would like to end their own life, it would be respecting patient autonomy to be allowed them to do that. Alongside this, there's evidence to show that public opinion is changing. So the Royal College of Physicians in 2019 had a vote amongst their members and they came out with a neutral stance towards euthanasia. And the same thing happened with the BMA members who voted in 2021. They also came out with a neutral stance. Another argument that you can use in favour of euthanasia is that doctors should be relieving suffering and not leaving patients enduring diseases that are significantly inhibiting their quality of life. On the flip side, against euthanasia, we have the argument of non-maleficence. So one of the 4 pillars of medical ethics being that doctors should not harm patients, and clearly by ending their own lives, they are doing harm to patients. So one argument is that it should not be within the responsibilities of a doctor to have to take a patient's life. So next is the slippery slope argument. Now, the premise of this is that while we are meant to be upholding patient autonomy, there is dubiousness or a lack of certainty around how much influence is being put on patients who are deciding to end their own lives with euthanasia. For example, a patient who is very elderly and feels that they are a burden to their carers and to their family might be feeling pressured into asking for euthanasia to end their own lives, to end the burden that they are on their family and carers. The concern of the slippery slope argument is that the line for where we draw consent for euthanasia will continue to the point where patients are having euthanasia happen and it is involuntary euthanasia without consent.